Hello, welcome. I'm Gibbings-Isaac. I'm a physician by background and I help healthcare companies grow, innovate and transform. Now, since the pandemic hit, it's been quite the roller coaster with a lot of change to say the least, especially in healthcare. Equally, there has been a lot of speculation around both the state of and future of the industry. And so we conducted research to understand the impact of the last year on clinicians, to understand more about their outlook and get their view on digital health trends while we try to decipher hype from reality. Earlier this year, we surveyed over 300 US health professionals to understand their perspectives on three key themes. First, how they use digital health tools. Second, what they will and won't do with artificial intelligence. And third, how COVID financially impacted their practice as well as their outlook for the future. To participate in the survey, our respondents had to meet three criteria. They had to hold a clinical degree, be directly responsible for making decisions about diagnoses and treatments, and be currently practicing medicine. Our respondents had good regional representation. About 75% were MDs, and more than half were either influencers in technology decisions or were the decision makers themselves. Today, we'll focus on four key observations from the survey data. We've seen clinician resiliency in the new normal, a continued acceleration in the adoption of digital health tools, a growing openness to incorporate AI into practice, and an impact on clinician finances, but not complete devastation. So let's get into the details. Clinician resiliency in the new normal. It was certainly a challenging time for clinicians. 30% considered actually leaving medicine in the last 12 months. But that said, our data suggests that clinicians are resilient. 86% of them said they are still satisfied with their careers. And perhaps we can go one step further and suggest that many were optimistic for the future, as 65% of clinicians said they would recommend medicine as a career to the next generation. Let's talk about the adoption of digital health tools. Nearly half of the clinicians we surveyed believe that they are early adopters of technology for their personal lives, and the majority of the rest adopt based on what others do and recommend. So, this suggests that there is a solid foundation for technology adoption within the clinical workplace. That adoption is only getting easier, as 78% of clinicians agreed that the pandemic made it easier to adopt digital health tools, and 57% agreed that these tools were user-friendly and easy to learn. 92% of clinicians have recommended digital health tools to their patients. 57% had recommended remote and virtual care with a healthcare professional, and just over half had recommended a mobile or tablet application. However, broader adoption barriers do still exist, particularly lack of interoperability between different IT systems, security concerns around patient data, and clinical workflow integration challenges which still persist. So how do you continue to drive clinician adoption of digital health tools? Our survey found that for the majority of clinicians, improving clinical outcomes while making their lives easier is a prerequisite for their adoption of digital health tools. And when it comes to clinicians recommending digital health tools to patients, clinical effectiveness was considered most pivotal for clinicians, with 65% citing it as an important factor. Interestingly, this far outweighed financial incentives, as reimbursement as a driver is pretty far down the list, with only 13% citing this as an important factor. Workflow integration was the second most important factor, and interestingly, security and privacy was in third place. And that could be explained by the finding that more than half of clinicians feel personally responsible for patient data privacy issues arising from the use of digital health tools that they prescribe. And now let's shift to artificial intelligence and machine learning. There's been a lot of buzz around AI and machine learning in healthcare, and we found that 1 in 5 clinicians believe they're already using it, and that's across both administrative use cases, such as note-taking and summarization, as well as clinical use cases, such as early disease detection and diagnosis. And for the 80% that aren't using AI and ML in their practice today, well, the vast majority are interested in using it in the future. Our last Digital Health Tech Vision report found that clinicians are hesitant to use AI. However, our survey revealed that despite the hesitancies, clinicians do see the benefits that AI can bring. More than half pointed to the potential benefits for better diagnosis, including assisting with judgment. And just under a third pointed to the potential for either greater procedural accuracy or to allow them to spend more time with patients. We've also found that providers are investing in the value of AI and digital health tools, as 1 in 5 clinicians confirmed they had already received training, and a further 26% confirmed that they were due to have training in the near future. So let's close out with financial impact. Even though there was economic hardship due to COVID, with 43% of clinicians stating that their financial situation worsened in the past 12 months, we potentially reached an nadir, as 70% describe their practice's current financial position as highly or somewhat stable. To recap, we've gone through 4 key observations. We saw resiliency in the new normal. Clinicians were tested, but coming out of the peak of the pandemic, they showed greater optimism and were generally satisfied with their career and would recommend it to others. We saw a continued acceleration of digital health tool adoption. Both adoption and recommendation accelerated during the pandemic, although some barriers still remain. We saw an openness to using AI and ML in both clinical and administrative tasks, with some clinicians actively using it and already having training, and others gearing up to do so. And finally, less financial stability for clinicians, but by no means devastation. Thanks for joining.